All right, I just want to, we kind of reviewed some of this concept in the cervical region, and I want to review it now with the lumbar since we're working a lot on the lumbar area. The idea is that what I basically had you doing initially, I didn't put the spinous processes in here, but they're big old spinous processes, which are pretty easy to feel. The idea was to have a person, again in this case lateral recumbent, where you're basically bringing the hips into a flexion position, bringing the knees towards the person's chest. As you do that, what do you expect to experience, just generally, within the lumbar spine? Assuming that it's not completely wrecked, what would you normally experience when you bring the knees towards the chest in a lateral recumbent position? What should occur? Mechanical flexion should occur, and you should have what? Right? You should have increase in space in all these areas. Should have an increase in space, okay, on opening. Likewise, what's going to happen to the musculature in that area? You know, the erector spinae muscles. Big, long erector spinae muscles, right? Okay, and remember, we also have muscles what? Between the transverse processes and the transverse processes. And we also have muscles that go between the transverse processes and the spinous processes as well. Okay? So depending upon your level of attention and your layer by layer palpation skills, you may be focused on kind of the big things out here, paraspinally, kind of increasing tension or decreasing tension, whether you're flexing or whether you're extending, whether you're opening this up posteriorly or whether you're approximating it or closing it down posteriorly, right? Likewise, you could come in and you could focus on the multifidi or the rotatories as they're in there and sense what's going on with these fibers as well. Ultimately, we'd like you to be able to get it down to a level where you can focus on things intersegmentally, meaning either you're on spinous process to spinous process, or you're in between in the interspinous spaces. So you're either going to feel a separation when you do these movements, or you're going to feel a closure when you do these movements. Now, if you are in a scenario where somebody's lying lateral recumbent, and you say they're lying on their, this is the right, this is the left, say they're lying on their left side. They're lying on the left side, and you let their ankles drop towards the floor. Their ankles drop towards the floor. What would you expect to happen?
Left side bend.
You would expect if the feet drop towards the floor, you expect this to occur, correct? Mm-hmm. You expect to see that. So likewise, what would you expect to find palpation-wise within the lateral musculature? It would become what? Loose, right? And this would tend to become tight or taut, whatever term you want to use. Okay, so this side would open up, this side would close down. That represents left side bending. Okay? Now we haven't done this yet, but if you put the person prone, you put them prone, on their abdomen, and you put your hands in here like this over the transverse processes. Suppose this transverse process is more posteriorly prominent than this one. This one's prominent, okay, or posterior. This one is not prominent, or it's anterior. Which way is that segment relatively rotated from that just static finding? It's relatively rotated to the right, okay? Likewise, if we take, and we are on the transverse processes, if we give a translation, from the left to the right, or from the right to the left, let's say it translates well this way. Right? Say it translates well this way, from the left to the right. Be very, very quiet. I'm doing osteopathy. I'm our fun people. In any case, it goes from left to right. It translates well from left to right. Which way is the side bending? Side bending is to the left. And this is the same as what we were discussing up in the cervical region. And if it follows the rules, okay, and we find that several of them have this type of a pattern in the lumbar region, several of them have a favor of that, then this is an indicator that this person has a bit of what? They have a bit of scoliosis, don't they? They have a lumbar scoliosis, and you could name it by the convexity to the right, or you could say concavity to the left. Basically what you're saying is it follows a Fryette type 1 because it's rotating these. These are rotating relatively to what? To the right, and they're side bending freely to the left. Okay? And if you were going to, if you say this was a functionally induced scoliosis pattern, meaning it's just because of abnormal muscle tensions. If you wanted to apply a muscle energy approach to this, what would your goal be? Your goal would be to what?
Side bend right, rotate left.
Right? Yeah, it's going to be basically to what? Shift and reverse that pattern. Shift and reverse that pattern. Now, some of the approaches we were using on the table make that very simple and easy to do.